Ambulance, what's the town or suburb of the emergency?
Brisbane. His blood is literally squirting.
Okay, get
over the
a
roof.
towel and apply firm, steady pressure directly to the wound. And do that now.
We tried to wrap around it and it's squirting out. It's really bad.
Okay, now help has already been arranged, okay?
Please, it needs to hurry the up because I don't know what the I'm doing. I'm not there.
For right now, okay, and I'm here to help you to tell you what you need to do, alright?
Need to hurry the up. He's gonna die.
As you keep firm, steady pressure on that wound, you're doing
I'm trying to. I'm trying to do the best I can.
completely alert.
He's got asked some questions. Just hurry the up and get here.
Okay, this is
He's
important
gonna die soon.
information.
If he doesn't get here soon, it's gonna be on you.
It's
It's gonna be on your back.
I need you to listen.
You don't hurry up and come here, and if he dies, I'll blame
I'll tell you
you.
how to help
Everyone's
the
gonna
patient.
blame you when he dies. Please hurry up.
This is important information.
His blood is
I need you to
very
listen
bad
very
right now.
carefully so I can get vital information and give you instructions until help arrives. Do you understand?
He's got a big hole in his wrist.
Have you got a clean, dry cloth or a towel?
Yes, I do have a towel.
And are you applying that directly to the wound with firm, steady pressure?
It's wrapped directly around the room, but
Are
it's
you applying firm, steady pressure directly to the
Hold on,
wound?
sit down, brother, sit down. I'm holding it.
Look and keep firm, steady pressure on, okay?
I hope I'm holding pressure in the right spot, but I'm not seeing any blood leak out now, so I feel like I have it in
That's
right.
what you need to do then, okay?
Combination of drugs and alcohol. His favourite saying is, "It's on you. If he dies, it's your fault." He was saying to me on the phone. But in a way, that's fear. Person's afraid of what's going on in front of them with the blood. So you cannot argue with a drunk. They're always right. So you've got to make your way through. He eventually started listening.
Tonight,
Calm before the storm.
Australia's busiest ambulance service lives up to its reputation.
Won't stop vomiting and really worried. What caused you to fall over?
I was drinking.
Like the theme tonight.
With a shocking crash for a young driver,
The head injury, blood gushing from head.
an athlete in agony,
Do you know how far the Javelin's gone into his groin?
Very important area.
and a commuter's worst nightmare.
Good news is we know what's going on, mate. The bad news is it looks like you're having a heart attack.
With exclusive access
Code 1 Alert, Fortitude Valley.
from the operations centre
Just want to stay on the phone with you until we get there, okay?
to the paramedics on the front line.
We've got a single motorbike RCC here.
These are the stories behind the lights and sirens
It can be rough sometimes. That's what we're paid for.
of Queensland Ambulance.
Ambulance, what's the town or suburb of the emergency?
Ambulance, what's the town or suburb of the emergency?
Ambulance, what's the town or
Ambulance,
suburb
what
of
is
the
the town or
emergency?
suburb of the emergency?
I'm trying to help you. You need to listen to me, okay?
So he's got a large laceration to his head.
And how many people are hurt there?
He said he could see his skull.
So we are coming lights and sirens, so we are coming as fast as we can.
Assaults,
Don't move the patient.
drinking,
Okay, can just stop for a moment?
car accidents.
Just one vehicle involved.
Shenanigans have begun.
In the Brisbane Operations Centre, the notorious Friday night shift is well underway.
It's literally when the sun goes down and you just think, oh, it's really happening like it's on here.
On average, call takers will answer one call every 70 seconds.
All units, I have a code 1505246. I think you are closest.
Each job is assigned a code,
And what colour are her lips now? Are they still blue?
which determines who gets helped first
No, you haven't been forgotten. Her husband's been on the floor for an hour.
and where you sit in the queue.
206, guys, have you closer for a Code 1 now. Put it through for a possible downgrade. 384, I will send you to a 2 Alpha. Roger, thank you.
Tonight, 87 paramedic teams along with 17 single responder units are covering the Brisbane metropolitan area.
Ambulance, tell me exactly what's happened.
Someone got shot with a gun.
He got shot with a gun.
Yeah, like a nail gun.
A nail gun?
Yeah.
So not a rifle?
Yeah.
Is it a proper gun, sir, or is it a nail gun? There's a big difference.
He's just got shot. I don't get what else you want to know.
Due to the potential severity of the incident, it's coded as a 1A, lights and sirens. Senior Operations Supervisor Dan is dispatched to manage the scene in case the injuries are critical.
The original case came through saying that it was a query being shot in the neck by a nail gun.
You there, love? Yeah, so I'm just trying to confirm. He said it was a nail gun, but he also said it was a gun.
Yes.
What was it?
It's a nail gun.
A nail gun, okay.
No, it's a 22 bullet. It's a 22 bullet he's talking about.
So it is a proper gun?
It's a proper gun, but there's a bullet there. Wow.
Alpha 505302, there were conflicting notes in the case, but the latest one confirmed it was a gun.
It's now been confirmed that it was an actual gun, not a nail gun, so we've got police responding as well as critical care paramedics and a crew.
Roger, thank you.
Dan is closest to the scene. He is 7 minutes from the incident. A critical care paramedic is dispatched and is 9 minutes away. Ambulance 5289 will be on scene in 15 minutes. Multiple police units are also assigned to the job.
The moment you hear shooting, it catches you by surprise. It's certainly something you don't see a lot of, so there's a little bit of scare there. But you back yourself, you back your colleagues. We just staged here the critical care paramedic as well. Police have just gone past us, lights and sirens, so they're going to secure that scene to ensure that there's no damage or danger to us, and then we'll proceed in as a team. We want to make sure that that scene is completely clear of any potential dangers to us because no one wants to rescue the rescuer.
Goes to 507084, 505302. Safe to go in as per GPS.
050704, thanking you. 302084, moving into scene. The unknown is something that we deal with in every single situation we go to. That keeps you on your toes.
Hey, what's happened tonight, buddy?
I just dropped it and I went off.
Pop that on your finger, mate.
So just one time?
Lucky, eh?
Regardless of what's gone on, we'll treat clinically and we'll treat that patient to the best of our ability.
Have you got any difficulty breathing at the moment?
No. Where's it go through?
What's that?
Did it go through?
It's gone through. Thanks.
Oh, so it's not in it.
He's got a single gunshot wound, but it's just it's through his shoulder and out.
You've got no other injuries anywhere else, buddy?
No.
No pain in your legs?
No.
Nothing in your groin?
No.
He was incredibly lucky. Whether it did drop while he was cleaning it or whether there was something else that went on, we'll never quite know.
I get my head.
Going to get you outside to the car.
An inch or two difference. It can be a centimetre difference, a millimetre difference. It's an absolute lottery. Will you get him a little bag if you've got his wallet or anything? Yep, he's got the phone. All right, we're going to take him up to the PA hospital, OK?
PA.
All right.
Good.
Love you, my mate.
Okay, love you. All right, give us a ring, eh? You got your phone? Yeah.
You guys happy for that to close up?
Yes, please.
Thanks, guys. Can't pinpoint exactly what it is at night, but they can get weird and wonderful. 0084, no units will be left on scene.
It's nearly midnight in the operations centre. 287 call-outs have already been dispatched and the calls continue to stream in.
Here we go. Ambulance, one of the town or suburb of the emergency.
House is on fire.
Okay, is anyone inside?
There's nobody inside.
Okay.
I've got 3 young people injured at the moment.
Okay. I need some help for them, okay?
I hit the head, blood everywhere.
And what caused you to fall over?
I was drinking.
There was 20 plus people in a fight, and one male was knocked unconscious.
We've got only one car there and a plethora of pending cases.
453, I'm just about to clear you.
Roger.
Ready for their next job are veteran paramedic Shane and rookie Shelley.
But I mean, I haven't even done an asthma that sick yet. No.
Shelley is a new gen paramedic with a university degree, while Shane's 15 years experience has been on the job.
You can always get the big RTC on a Friday, Saturday night too.
Yep.
A lot of the big jobs I go to, it's still the first time I've gone to it. Can I handle it? Yes. But has Shane seen it 100 times? Also, yes.
I haven't seen the moon tonight, have you?
How do you know where it's at, though?
I'll look up in the sky. Like most other people.
Ambulance, what's a town or suburb of the emergency?
There's been an accident. A car's run into, I don't even know what, a van on the side of the road.
How many people are hurt?
There's just one driver in the car by the looks of it. He's stuck in there.
Ooh, here you go. 1B, male conscious breathing car versus parked car. He is stuck in the car with a head injury, blood gushing from head.
In ambulance 5453, Shane and Shelley are 14 minutes from the crash. Senior Operations Supervisor Dan has also been dispatched and is 8 minutes away. Additional police and fire units are en route.
It looks like there's multiple calls coming in for this one, which usually means it's something that looks pretty big because a lot of people will drive past and see it and want to call it in. Police are there now, male believed to be trapped in vehicle, unknown if he's conscious or not. Nil further at this stage.
Entrapments are very hard to access and they can go downhill pretty quickly. Clear left. You've been to a ton of these, Shana. Any advice for an entrapment?
Do your basics, get appropriate OV access and pain relief on board, and be ready for it to go south.
Yeah.
It's always good to work with someone who's enthusiastic as Shelley. She's got really good book smarts, and I've got the experience. So we work really well together in that way.
I wonder if he's been drink driving or just lost control of his car. Pretty unlucky to hit a parked car.
Well, they do jump out in front of you.
The parked ones, yeah.
There are 4 male patients, except 14 intoxicated.
Oh, as suspected. It's a residential street. Run into a car.
Taking the back streets home.
Yeah, busted custard.
Before I started as a paramedic, I had a really low threshold for drink driving. A few boys I knew growing up in high school were in an accident. They were both drinking at the time and they died. And ever since then, you just think, why do people do it?
Oh, there you go. Dan's on scene. All right, boys and girls, it's game time.
In southeast Brisbane, Senior Operations Supervisor Dan is first on scene to a young male driver who has hit a parked car at speed.
Over the years that I've been in this job, I've seen multiple lives lost because of drink drivers. Hey guys, what's going on?
We crashed the vehicle.
Yep.
You can smell a bit of liquor on his breath.
Okay. Whether it's a child, whether it's a grandmother, whether it's a member of the prison system, at the end of the day, it doesn't matter who you are that we go to in the community, you receive the same level of care from our paramedics. Hello, I'm Dan from the ambulance. I'm going to get straight to the point. You've got a lot of blood around your head. Yep. Okay, so you've crashed your car, possibly had a bit to drink tonight. Now, have you knocked yourself out at all? Do you remember everything that occurred? Let's grab one of your hands.
I remember
Remember most of it?
I wouldn't remember, crashing.
Okay. Yep. You know, head injuries, people can be acting quite normally and there might be a slow progressive bleed on the brain. So try and stay nice and still. Don't move your head for me, okay? Try and stay nice and still because it looks like a big impact that you've had here, okay? Yeah. So you want to stay nice and still. Yeah. Because you don't know what's going on and because you've got a bit of alcohol in your system as well. We need to take you up to hospital. It's unpredictable. You don't know what's going to happen. Well, apparently you've come into the back of this car here, okay? But as you can see from your front windscreen, you've done a heck of a lot of damage there. Keep that head still for me. Hey, how are you? You did crash. This is Shelley, okay? So he's a little bit drowsy. Basically, he's flown about 0.073 or so. DCS 14, doesn't know what he's done, doesn't know where he's been.
That's all right, I'll tell you what. We're going to get you on our bed. What we really want you to do is keep your head still. I know Dan told you that, though.
You guys are nice and slow.
Nice and slow. Nice and slow. That's it. Go spin around. There we are. Pop your bottom up. All right. Because he can't quite remember the event, we're going to take all the precautions we can. They're just going to do a few other little things. They're just doing a full assessment on him at the moment.
You'll go to a car crash and people can look really well when really there's something else going on underneath.
Do you have a headache? Oh.
Not really.
Do you have pain anywhere?
No, I don't.
No?
Just because someone comes out walking and is talking to you doesn't mean they're not sick.
What happened with you? No, you did something.
You've been in a car crash.
Car crash?
Yeah.
I'm going to guess that you didn't have the seatbelt on, to be honest, because...
He's got no seatbelt marks. Probably hit the windscreen then, hey?
Yeah, I'm pretty sure he has, to be honest.
Yeah. Were you wearing a seatbelt?
I was actually walking,
All right, it's going to be a sting in your arm. I need you to stay nice and still,
You
okay?
were walking to a mate's place. You were seen in the car, buddy.
Oh, was it?
Yeah. You've been in a car accident.
The hard thing when they've been drinking is intoxication and head injuries present very similarly clinically. So it's about, acting smart and acting fast.
So you crashed my car.
You did.
Hey.
So our concern is you've been in a car crash and you're quite confused because it could be a little bit to do with the booze, but worst case scenario, you have a head injury, okay? So that's why we want you to stay really still. We're going to keep rousing on you, but we're going to take you up to hospital, they're going to fuss over you and they're going to do scans, okay? Happy days, we're good. Sorry?
What happened with you?
I suspect that you have driven your car and I think you've just clipped the back of a truck. Parked car. Just leave your head, leave your head. Leave it, don't pull it off. Well, now it's in your eyes. No, let me touch it. All right, hands off, don't touch your head. New house rule, don't touch your head. All right, you good? Okay. Do you remember us getting to you? Yeah?
Yeah.
Do you remember what happened yet?
Going up inside. Crashed the car.
You can't really remember, hey?
Yeah, I can't.
That's all right. Like I said, it's more important that you're okay.
Oh, absolutely.
Yeah. No. Just stay really still, okay? Well, they're gonna love you in here, hey, Shane? Well, I hope you get discount at work because I've cut your clothes off. You're a lucky boy.
It's 2 a.m. and Shane and Shelley have still got 5 hours to go on their shift.
More lamb chops. Put that in the vent, please. I want to smell that the rest of shift.
Lamb chops and a risotto.
Of all the delicious things you've ever brought to work, Shane, that takes the bait. That smells so good. It's the highlight of my stint with you has been smelling your lamb chops. Oh, not even joking.
Friday night special.
Oh, so good.
Ambulance, tell me exactly what happened. My partner obviously can't handle alcohol very well, which I had no idea of. I've had more alcohol than he is. He's been vomiting for about 20 minutes. I've tried to get a piece of plain toast into him, but he just won't stop vomiting and he can barely even see straight. And I'm really worried. Is he completely alert? No, he's almost like narcoleptic. Is he breathing normally? Not really, it's quite slow, heavy. Is he bleeding or vomiting blood? There was a little bit. I'm really worried about him. Alrighty, so the paramedics are organised. Alrighty, awesome, thank you so much.
We're going to a 20-year-old male who's been drinking
and he's been vomiting for 20 minutes and won't stop. Obviously, if he's that intoxicated that he can't manage his own airway...
He's a bit of a risk to himself.
Yeah, concerns he could vomit and aspirate.
Yeah.
It's just going to be a whole new world of hurt for him.
What did you say? It is what it is. We're dealt the hand that we're dealt. It's just another day in the life of a QAS paramedic and a page in the book. I like working with Shano, probably one of my favourite people to work with. He brings a life experience. He's a good mentor. It's fun to learn from, but it's also fun to be that young one who just keeps him on his toes, just annoys him all day. Shane, it's your little girl's 18th tonight, isn't it?
It is.
Do you think there might be some 20-year-old drunk boys vomiting at her party?
If that's all they're doing at her party, that's okay. Nah, she's a good girl. She'll be fine.
In Australia, we seem to have this culture of young people with parties and binge drinking, trying to get as drunk as you possibly can until you pass out. I really think alcohol is the biggest problem out there.
Yeah.
It's a legalised drug, so I'm not really sure what the solution is, but we do need to look at it as a community, as a society, on how we can probably address that a little bit better.
How you going, guys? How you going, mate? All right, where are we going? Inside, is he? Oh, is there a party here tonight? The 21st.
Is that vomit? No, we don't want that. We'll get a clean bag. That's
I don't think anyone wants that.
Here you go. Happy birthday. Put him on that tree.
All righty. I might ask some of you guys all to hop outside if you don't mind.
All right, your job is hold. No. Hold the yellow bit.
Can we get you guys to all hop outside? Tell me what's happened tonight.
A mix, maybe rum and coke, wine coke.
Yeah.
That sort of stuff.
No worries. Has he ever been like this before?
Not that I'm aware of.
Yeah. Does he live here or is he lives here? Is this Mum?
Yeah, that's Mum, yeah.
I'll just go and have a chat to Mum. Hey, Mum. Any other medical history, Dale?
He's on tablets. He did tell me earlier on tonight that he's found out some bad news about his father.
Alrighty.
I'm not his natural mother. I just took him in when he was the age of 14.
When I see these cases, I think of my kids. We quite often deal with vulnerable young people in our job. It can be tough hearing some of these stories people have, some of the hard upbringings they've had. It can be quite heartbreaking as well. And that's why it's also important never to judge a book by its cover.
How many drinks did you reckon? Over 20 drinks.
Because he's vomiting, he's unable to walk properly. Our concerns are if he's laying on his bed, if he's asleep, he vomits, he could aspirate on his vomit and get sick. So he needs to go to a place where he can just be watched for a couple of hours and be looked after. Now, you two seem relatively sober. I've got a little job for you.
Yep.
Is to get them out to our ambulance safely for me. You need to walk for them. Sit down there. Good work. I hope this isn't happening at my daughter's party.
I think worse is going to be happening. She's her 18th.
All righty, mate. Let's get you to a safe place, eh?
If you don't have empathy or sympathy for some of these people, you're not going to last very long on this job. Quite often, some of us will save up our empathy for those that we believe that deserve it.
Hello. Can you hold your head up straight for me? That's a bit better.
Those that do deserve it certainly will get it in bucket loads.
So how did you two meet? Out of interest. I was going to say, which website? And is this the one? Is this the one? Is this the big relationship?
To the hospital.
Sounds like true.
Telling someone you love for the first time while throwing up into a bag's romantic.
He told you he loves you. Oh, that's so sweet. Hey? This just sounds like true love. So is he going to be in trouble tomorrow with you?
I just want to make sure he's all right. He kept saying sorry. I wanted to smack him. I don't care that he's done something silly. He drank less than I did. It's not his fault.
I actually suspect he might have had a little bit more than you than I did. Hold your hand up.
Is it my job to look after everybody out there? Of course it's my job to look after everybody that's out there. Is it a job that I want to do? Absolutely. That's why I keep telling everybody I think I've got the best job in the world, because it's just something that I want to do.
Thanks for your help tonight. Appreciate it. Poor young fella. I think there was something wrong with the 20th drink that he had that made him unwell.
Probably.
The first 19 were okay, but
Usually it's the 20th that gets you.
one that just was pretty much how we've done many, many times before.
And many more to come.
To come.
It's 6:15 a.m. and as the city of Brisbane wakes up, paramedics Shelley and Shane are nearing the end of their shift.
Being in the cab with your partner for 12 hours a day, you get to become very familiar with each other. You overshare a lot.
I feed my cat Sweet Bix.
Of course you do.
Yeah, they usually have steak for breakfast. Sweet Bix is just like a sometimes treat.
What sort of steak do you feed them?
Just cat steak.
Is there such a thing as cat steak?
Yeah. It's just cow steak, but they cut it up so it's like cat-sized pieces.
You are going to grow into be a crazy old cat lady.
Not even when I'm old. Goal is by 30.
All right, so I'm organising help for you now. Just stay on the line and I'll tell you exactly what to do next.
In the Brisbane Operations Centre, overnight call takers have answered more than 600 calls. 6:20 a.m. marks the changeover from night crew to day crew. The call takers start earlier than the on-road paramedics to assist with the handover of active jobs.
Any crews that logged on, I've been actually paging them, telling them at the same time about the CT scanner.
Yeah.
All right, have a good day.
All right, you too.
See ya.
The people that have been out are now home and sleeping, and all the other people that would go out to the beach or to play sport or whatever, they haven't started that yet. Yeah, it'll be quiet for a few hours, I think.
I was playing soccer and I slipped over, hit the ground, and I was dislocating my shoulder. How high is the tree?
Yeah, how high was he in the tree?
Oh, well, quite a big tree, apple tree, you know.
I've got a boy who looks like he's hyperextended and broken his elbow or his upper, just above his elbow.
All right, I'm organising help for you now. Just stay on the line. I'll tell you exactly what to do next.
Ambulance, what's the town or suburb of your emergency? Hi, I'm calling from Alternative train station, Sunnybank. Okay, tell me exactly what happened. I've got a 67-year-old male who's got chest pain and he's got pain down his left arm. All right, I'm organising paramedics to help. Just stay on the line. I'll tell you exactly what to do next.
Alrighty. Shelley.
What do we got?
67-year-old male, chest pain at the train station.
At the train station?
Yeah. Is he completely alert? Yes, he is. And is he breathing normally? Are you finding it hard to breathe for? Yes.
He saw us at the intersection.
Alrighty, game face on.
All right, game face. Hang on, let me put a nicer siren on. There we go. Oh, this could be it, Shane. Could be a big STEMI at a train station.
It could be. Let's hope for his sake it's not.
As a paramedic, you're always looking at what could be the worst case scenario that could happen, because we've been to those worst case scenarios.
That's our meeting party there.
Jump up on the grass?
Why not?
Why not?
I think because you see so many different things, you have a greater understanding of how life can just change in an instant, not only for the patient, but for the family. You just realise that life is pretty precious.
What's going on, Alan?
Pain here.
Are you feeling dizzy or lightheaded?
Oh, no, just the pains.
All right, how bad's that pain out of 10, buddy?
Oh, I'd say 9.
9? Did you get sweaty at all?
Yeah, a bit.
Yeah. All righty. Have you been well recently?
Yeah, I've been really good.
All righty.
I lost 1 kilo between last year and now.
Oh, well done. I found it.
all here.
Yeah.
So what time did this pain start?
Probably about...
It's about an hour ago while you're walking up the hill, eh?
Yeah.
So you've got your inferior, definitely. You've got your ABL and lead one. I'll go get us a bed.
Good news is we know what's going on, mate. The bad news is it looks like you're having a heart attack at the moment.
At Altandi train station, Shane and Shelley are treating 68-year-old Alan, who was found collapsed with chest pains.
I'll go get us a bed.
Good news is we know what's going on, mate. The bad news is it looks like you're having a heart attack at the moment. OK.
Cardiovascular disease is the leading cause of death in Australia, claiming one life every 12 minutes.
Generally, they're very calm. I've never really seen anybody panic too much. They're quite shocked to what's happening, in denial that this is happening to me.
Father died of a heart attack at 60.
What I'm going to do is we're going to get critical care paramedic here, and he's going to give us a hand.
With Alan's condition deteriorating, highly trained critical care paramedic Sophie is dispatched to assist.
302, code 1. Basically, a heart attack is a blood clot in a small vessel in your heart, which obviously stops blood flow and in turn oxygen, and the heart becomes damaged.
Just want to do another ECG on you. Yep. Not much doubt about it, I'm afraid, mate.
Does every minute count in these situations? Absolutely. Every minute he's waiting, every minute he's got that clot in his heart, he's got muscle starting to die.
Alpha is from Nathan, so shouldn't be far.
Worst case scenario is that he arrests and dies.
That's okay.
Alrighty.
So just full of rubbish.
We've got a bit of a difficult extrication out of here, mate, so...
We're in the middle of a train station. We obviously can't go out across the rails. We need to go up a lift, across a rail, down another lift. They talk about the duck floating across the pond, nice and smooth, but underneath those duck feet are going 100 mile an hour. That's generally a paramedic. Nice and smooth on the outside, but inside we're going at 100 mile an hour, trying to ensure that we do everything that we can to save this patient.
Sounds like our help.
I'd just like to make a PCI referral for a 67-year-old male.
Sophie calls ahead to the hospital so Alan can be delivered directly to cardiology for surgery.
Got a strong family history. He's normotensive, but he is bradycardic at 50 with an inferior pattern.
With his condition so fragile, Sophie will travel with Alan as he may go into cardiac arrest.
You live at home alone, mate, or with your wife?
Wife and 2 sons.
Oh, sorry, Alan.
That's all right. It's not my fault either, it's the genes.
Yeah, your father, was it?
Yeah.
Sorry to hear that. Did he pass away?
Yeah, he had one. He's in hospital. Taken home a couple of weeks. Another one.
I'm sorry to hear that.
They're looking at you and praying that things are going to be okay. You can see that in their face. All we can do is give them reassurance.
We made it, buddy. All good, eh?
Done really well, Alan.
All right. Everyone happy?
Yeah.
Saving a life, getting someone to somewhere where they can get their life saved, it gives you a sense of accomplishment.
And how's your pain, Alan?
It's a special privilege. You can say I played a small part in that.
All right, let's go. Home, James. Home.
Rainbow! This doesn't sum up our time together.
Roger 601451, good morning to you. Test page is coming through.
451, thanks for that.
In Brisbane's south, paramedic Peter and Phil are signing on for the day.
Put the seat down, mate, so if you need to pump it up...
No, not at all. I put it further down.
All right, really?
Having recently transferred to the Nathan station, this is Pete's first shift working with Phil, who immigrated from Hong Kong 10 years ago.
I have coffee, then tea, and then booze.
Booze?
Yeah, no.
Little nips of a scotch or...
Not that one.
Not that one. So what did you do back home?
Me?
Yeah.
Oh, I'm a boring boy. I did very similar.
Yeah.
So I was an ED doctor.
Yeah, wow, that's awesome.
And we don't have paramedics.
At all?
Doctor and nurse are in the ambulance.
Okay.
It was quite good, but the workload. How many patients we got in total for a day? The highest?
I think the highest I've done is probably 7, 8 in a 12-hour shift.
Similar as me, but back to China.
Yeah.
50 is the least.
What? 50?
Yeah. Can up to 85.
Really?
Yeah.
That's nuts.
Ambulance, what's the town or suburb of the emergency?
My wife's beside me. She just got clipped with a chainsaw.
Can you see or feel any part of the baby?
She's got her handcuffed.
Oh my God! And my son, I think he's having an allergic reaction to something.
So has he ever had a severe allergic reaction before?
No.
Never.
This is my buddy, his Javelin, and it's penetrated into his groin. Okay. So he's in a lot of pain.
An urgent call has come in from a sports field south of Brisbane CBD.
Now, is there any serious bleeding? Yes, it's bleeding a lot.
Has it gone into his penis or his testicles at all?
Right.
You need to look at it for me.
Can you just roll over for me, buddy? I think it's in the west of the groin. Jerome, is it in your genitals?
Patient's a 20-year-old male, punctured and breathing. He has trauma, javelin to the groin. Code 1, all units, thanks.
It's a long spear.
Yeah. You throw.
Flow into the groin and close to the testicle.
Peter and Phil are the closest ambulance and will be on scene in 5 minutes. A critical care paramedic is also dispatched.
Is it a large wound?
I think it might be quite deep.
There are definitely times where you look at and the details coming through and you just don't believe what you're going to. You just think, how can this be real?
Yeah, how's that bleeding going? Keep fair, steady pressure on it.
You don't know what to expect heading in there, so you think, what am I going to do? I've got no idea how this person's going to be.
There's multiple ambulances on the way. They're going lights and sirens.
Here he is.
Yeah, he is.
Now, the ambulance has said they can see you where they are. Can you see them?
Yeah, they're right here.
They're right there. All right, Liam, I'll leave you with the paramedics.
Yes.
The initial minutes of cases like this are just definitely something that you can't train for.
In Nathan, south of Brisbane CBD, Phil and Peter are responding to a Code 1 emergency for an accident involving a Javelin at a sports stadium.
Here he is.
Yeah, he is.
Going through your head, you just think, I don't know what to expect. The initial minutes of cases like this are just definitely something that you can't train for.
Hi, I'm Phil. What happened?
There was a Javelin on the ground and he ran into the Javelin.
Oh, he ran into it, locked the Javelin, just flow. Okay. Yes, run. Can we have a look?
Yeah, sure.
Yes. So it's very painful? Yeah. Yeah, can you it's still bleeding or not?
I'm not sure.
Can you let go and we have a look?
If the Javelin has hit an artery, the patient may be bleeding internally.
And I need to put this off, okay?
Mate, I'm just going to do your blood pressure, okay?
Yeah, looks like it's the skin's open, but looks like inside is okay. The mark shows still there.
Jerome is lucky. The Javelin hasn't penetrated too deeply and his genitals are intact.
How bad the pain is at the moment? 7. Okay, this one is into your mouth. I'll try. It doesn't taste good, but it's good for the pain. You can hold it yourself. It's just a whistle.
451 injury is to his right side groin. He's GCS 15, well perfused, good radial pulse. That's the way. Keep breathing on that. Doing really good, Jerome.
We're gonna move here, okay?
Keep you nice and covered up, Jerome, okay?
Yeah, 1, 2, 3. That's it. Which country are you from?
Hong Kong.
Hong Kong.
Yeah, what about you?
廣東話、粵語。
我識講啦。
係啊。
Oh my god.
Before working with Phil, I didn't know a lot about him. So to find that he's worked as a doctor in ED departments within China, that's rare.
Cantonese.
Perfect.
This is my language. So how about a pain out of 10?
I think it's like 6.5 right now.
So everything's good so far, except the pain. Okay.
Don't mention it, it's fine. One more second.
I'm giving you morphine for the pain, okay?
Just gonna move off, Phil, okay?
Yeah, all good. Okay, can you tell us again what happened?
So, there's a javelin on the floor.
On the floor, yeah.
And then I ran into it.
You ran into it?
Well, I ran into it.
You ran into it. How about the pain?
I don't know anymore. Thanks a lot for it.
No worries.
Next time you come to Hong Kong, you should visit me. Seriously.
Yeah, why not?
Seriously. I like making friends.
Yeah, making friends is good.
Where's your mates?
Peter.
Yeah.
Hi, Peter. Hello. Thank you for driving. It was very good.
No
and
worries.
thank you for your help as well.
Thank you, guys.
Hopefully it was comfortable, Jerome.
Yeah, it's really comfortable.
All right.
Can I have my phone real quick? I just want to text my mom.
Why not?
Tell her.
Okay. Let them know.
Can I take a quick picture?
Why not?
If you don't mind.
Me?
Would you like to be in the picture?
Yeah, why not?
All right, thank you.
Or you can do the selfie.
Yeah, sure.
Hi.
I'm gonna be fine. I'll survive.
Jerome, it's not every day you get to go to someone who's had a javelin stuck in a sensitive place.
It's so unusual, right?
Yeah.
Next time, a surprising diagnosis.
Have you got any medical conditions?
Yeah, I'm dead.
Okay, that's a pretty bad one, isn't it?
A fallen rider. Feeling no pain. A child in trouble.
Every paramedic dreads a paediatric case.
So she fell from the seat to the floor, was it?
As paramedics go above and beyond to help.
Is that what you have your tequila in?